From ditching masks to talks of a fourth wave, Dr. Nina Radcliffe is here to break down the latest coronavirus headlines on this Friday. Good morning to you, Dr. Radcliffe. Thanks for joining us.
A great morning to you.
So we're seeing these reports of a possible fourth wave of coronavirus infections. What do you foresee?
Well, first of all, there's no strict definition of what is or is not an epidemic wave or a phase. A wave implies like a rising number of sick individuals, a defined peak, and then a decline. And so, with that understanding, another spike in COVID cases would mark the fourth wave of infections since COVID-19 was first detected in the US a year ago. We had the initial surge in infections in March and April, and they tempered off by June. But the new cases jumped again in the summer, and then a third wave happened during Thanksgiving, and after that, with travel and holiday gatherings and lifting of restrictions. And I want to note that there was a number of school closures, restaurant closures, even outdoor closures with that third surge. So now, after weeks of progress in the fight against COVID-19, we saw a drop in new cases of the disease, but this has stalled. And at the same time, we're seeing some states are lifting these restrictions that were meant to curb the spread of the virus.
Yeah, I was going to ask you about that because Alabama's going to join Texas.
Fourth wave of cases.
Oh, I'm so sorry. I was just going to ask you about this very quickly. Alabama is going to join Texas and Mississippi to get rid of the mask mandate. Iowa and North Dakota already lifted theirs. And there's states that never even had a mask mandate. Florida, Alaska, Arizona. Dr. Fauci was asked about this very thing, about some states lifting mask mandates. Listen to what he had to say.
I don't know why they're doing it, but it certainly, from a public health standpoint, is ill-advised. What we don't need right now is another surge. So just pulling back on all of the public health guidelines that we know work, and if you take a look at the curve, we know it works. It just is inexplicable why you would want to pull back now.
What's your thoughts, Dr. Radcliffe?
I agree. From a public health and scientific standpoint, it flies in the face of scientific evidence. Masks and other types of protective behaviors like social distancing, they curb new cases and they reduce deaths. And because there can be mixed messages, I want to be very, very clear. It is essential not to let our guard down at this level of number of cases. With variants spreading, we stand to completely lose the hard-earned ground we have gained. There are variants, and these are very real threats to America and our progress. So now is not the time to relax the critical safeguards that we know can stop the spread of COVID-19 in our communities, not when we're so close. These mandates are based on science to help keep us safe and save lives. They work. And I think it's important to understand that what evidence-based decision-making means. It's based upon peer-reviewed evidence, qualitative and quantitative research, conducting sound evaluation, knowledge, and results have been witnessed in the U.S. with public health measures over the last century. We have increased the life expectancy of Americans by 30 years in the last 100 years based upon public health evidence-based medicine, whether it's smoking cessation, safe water, injury prevention. So we need to follow the science.
I know you've got the COVID vaccine. You've gotten both your shots already. We both have children. What do you think about children getting the vaccine? Is that going to be imperative in the future?
Well, there's two key points. It depends on the child's age, but some teenagers could be rolling up their sleeves before long. Also, not until there's enough data from studies in different age groups, which will stretch into later this year, that we'll know. It is true that children generally do not have serious complications or die the same way that they may die from the flu, or adults have died from COVID or have serious complications. But again, in order to get herd immunity and stop the spread of COVID-19 and see these new mutations and variants that can keep going on and on and on, we have to immunize children. But before we can do that, we have to see how it works in children, the vaccine. The good news is that the Pfizer vaccine is approved for those 16 and above. Moderna, it's 18 and above, and they've already started testing in younger kids, 12 years old and above. We need to see how it works. Now, we do know that antibodies work against COVID-19. The question is, are we going to see the same response of antibody production in children?
Yeah.
The good news is these studies will take less time than they did for the adults.
And they're doing those studies right now. And finally, we're running out of time here very quickly, though. The CDC is now finalizing some guidance for individuals who have been fully vaccinated like yourself. So what advice would you offer to the CDC as they create these guidelines?
Well, I can't. I trust them as individuals. They look at evidence-based medicine, and I look forward to seeing what they are. I can't wait for the day that we can just take off our masks, we can travel, we can go see all of our loved ones, and we can get back to normal. But we can't do that at this point. So I look forward to what their recommendations are. I think they can be a beacon of hope as we continue to get our nation vaccinated.
All right, Dr. Radcliffe, have a great weekend. Great to have you here on this Friday.
Happy weekend.